Turning to our health lead now, and fears over China's COVID crisis worsening amid Lunar New Year celebrations. The Chinese government, of course, basically closed the country's international borders for 3 years while not taking critical steps to get the best vaccines and prepare its hospitals. The country's healthcare system has now been overwhelmed by a surge in COVID cases ever since they abandoned their zero COVID policy last month, the government. As CNN's Ivan Watson reports for us now, since that abrupt change, China went from reporting just 37 deaths in a month to admitting that the number was closer to 60,000.
A population on the move.
Attention, please.
After 3 years of restrictions due to their government's war on COVID, Chinese can finally travel again, just in time for the upcoming Lunar New Year holiday. In pre-pandemic times, this was described as the world's largest annual human migration. I haven't been home in 3 years, says this man at the main Beijing train station. Millions of Chinese people are traveling as COVID-19 spreads out of control. Chinese officials say COVID infections have passed their peak in many parts of the country, but there are clearly still concerns about the scale of the outbreak. For example, here in Hong Kong, authorities require all of these travelers arriving on high-speed trains from mainland China to get negative COVID tests first before they can cross the border. Last month, Beijing abruptly scrapped its strict zero COVID policy, the ensuing surge of sick people putting a strain on hospitals and health workers. Several social media videos showed nurses sick with COVID collapsing on the job. I felt unwell, says this nurse in Shandong. It had been a week that I had COVID-19 until that day when I finally collapsed. Over the weekend, health officials who once prided themselves on keeping COVID out of China abruptly raised the COVID death toll since early December from several dozen COVID deaths to nearly 60,000 people killed by COVID. But the official U-turn on COVID has had other unintended consequences. At a factory in Chongqing, workers pelted police with what appeared to be boxes of COVID tests. Some biotech companies withholding salaries or laying off workers after the government suddenly stopped demanding the population take millions of COVID tests a day.
The implementation of zero COVID and the abrupt and unprepared manner in which it was abandoned, speaks to a chronic governance failure.
One of China's richest provinces, Guangdong, spent around $22 billion over 3 years on pandemic prevention.
A lot of these local governments are highly indebted. They've got big cash flow problems. This is a big problem that the central government and local governments will have to sort out in this coming decade. But COVID just kind of made it worse, really.
For now, uncertainty over public health and government finances has done little to dampen a palpable sense of excitement. Understandable, as Chinese emerge from pandemic lockdown to celebrate the Year of the Rabbit, the biggest holiday of the year. Jake, I think it'll be some time before we can really assess the cost of 3 years of this failed zero COVID policy and now this abrupt whiplash where you've got maybe 85% of the population in some cities and provinces getting COVID now. The Chinese leader, Xi Jinping, he had fresh comments on the pandemic today. He said that the country has entered a new phase of the COVID-19 response and that tough challenges remain, but the light of hope is right in front of the country.